Mental Health, brought to you by Barber Behavioral Health, a service of Barber National Institute.
We're happy to welcome back Chris Elliott, Vice President of Barber Behavioral Health, to talk today for our segment about coping with that holiday stress. And Kara's already stressed out. I've talked her off the ledge a few times now.
This is the time of year it starts to creep up, and it's just more and more and more things to do. It feels like every year. Chris, I think it's safe to say we all feel that stress.
For a lot of people, this is their favorite time of the year.
Sure, right.
But for others, it also can be a very challenging time of year. And this year is a unique year. That time between Thanksgiving and Christmas is condensed since Thanksgiving is so late. So one of the key things that we can do to help cope with this holiday stress is set realistic expectations, right? So we only have 3 weeks or so between Thanksgiving and Christmas year. So how many events can you realistically fit in? How much shopping can you realistically do? So, set yourself to succeed rather than just trying to do all of it at all the time.
I think that's such a good point, because we're the ones setting this expectation for what we want it to look like and feel like and be like, when we can lower that a little bit. We're all human.
Be realistic. And even set a budget, right? We all can do that. Another thing that people struggle with is, being lonely. They might have lost a loved one. So there are things that you can do. It is okay to seek help during this time. Another thing that we've always talked about in our sessions lately is continue to do self-care, right? That is still important, even during the hectic times. Exercise, get your sleep, eat well. But don't be afraid to reach out to your loved ones, your coworkers. And an interesting idea that I saw was volunteer, right? What better way to kind of give back during this time?
It kind of shows you what's really important, right?
Correct.
And sometimes when you get so overwhelmed with all the big things, and then you start to volunteer in certain areas and you realize, wow, gosh.
Puts things in perspective.
It does.
Yes. And finally, it's okay to have those feelings of grief, happiness, loneliness. Like, it's okay to express those feelings. Trying to just bottle up and hide it all the time, only can kind of make it worse. So it's okay to feel all those feels, right?
Right.
Yeah.
So
and sometimes feel all those feels in the same day. It can seem like.
Yeah.
Correct.
Christmas can be very emotional. I'm thinking immediately for a Thanksgiving, maybe we want to just say, let's have no political talk at the Thanksgiving table. That brings
I
on
won't
a lot
even
of
touch
stress.
that here.
This is stressful
That brings
for
on
people.
stress for a lot of people. Yeah.
Correct.
Yeah.
Yeah. I mean, religion,
Yes.
politics.
Just be
like
mindful.
at work, right? We try to
Yeah.
be mindful. So, another thing, if you're struggling with maybe someone that passed away that was important to you, and you had this special tradition, maybe come up with a new tradition this year, so you're not stuck in that grief of an old one. Do something new and start a new sense of joy from a tradition you could start.
Right, rather than recreating and being sad and lost in the past. Yeah, very, very
all really important reminders as we start to get into that busy holiday season. So Chris, thank you for being here and sharing those with us. As always, you can contact Barber Behavioral Health if you just don't know where to start in your mental health journey. There are some details there on your screen, address and phone number.
Right now, as the weather is changing, let's send it